Let's see about the stages of labor. For that, first we should know what is the onset of labor. The onset of labor is defined as the start of painful uterine contractions which is associated with any one of the following, which are ruptured membranes, bloody show, or complete cervical effacement. This is the onset of labor. Now coming to the proper stages of labor. The whole process of labor is divided into three main stages. Stage 1 is from the onset of painful uterine contractions to full cervical dilation. This is stage 1. Stage 2 is full cervical dilation to delivery of the fetus. Stage 3 is the delivery of fetus to the delivery of placenta, and there is also stage 4, which is up to 2 hours post delivery. These are the main stages of labor. In addition, before the first stage, there is a stage called preparatory stage, which is about 2 to 3 weeks before the onset of labor in primigravida and a few days before the onset of labor in multigravida. So, in preparatory stage, there are certain events which occur. Those include the process called lightening. Lightening is nothing but the falling forward of uterus because the heads start dipping into the pelvis. So, that is called as lightening. Then there is shortening of the cervical canal. And falls or spurious labor pains occur during the pre-preparatory stage. Now coming to the first stage of labor, which we have already seen as the stage from the onset of true labor pains to complete dilation of the cervix. And there is effacement of cervix. The duration of the first stage is around 12 hours in primi and about half of it, that is 5 to 6 hours, in multigravida. So, in the first stage of labor, there will be true labor pains, there will be blood tinged mucoid discharge, which is also called as bloody show. There will be dilation of the cervix, and there can occur the rupture of membranes. So, the uterine contractions initially occur at an interval of half an hour, but then gradually they start increase, and a good uterine contractions are when there should be minimum 3 contractions in 10 minutes, each lasting for 45 to 55 seconds. This is the criteria for good uterine contraction. And as we have seen in the previous video about the upper segment and lower segment, the upper segment contracts, becomes thicker and thicker as the labor progresses, whereas the lower segment becomes thinner and stretched to receive the fetal head. The junction between these two is called as the physiological retraction ring. Next, let us see the mechanism of dilation of the cervix. The cervical dilation is due to the result of the contracting and relaxing upper segment and the thinning out of the lower segment. Also, before the rupture of membranes, that is when the membranes are intact, the hydrostatic pressure exerted by the amniotic fluid after getting impulse from the fetus is responsible for the cervical dilation, whereas after the rupture of membranes, the impending presenting part exerts pressure causing reflex uterine contractions and thereby causing cervical dilation, and this is more powerful than the previous one. And the pattern of cervical dilation is marked using a graph called as Friedman's curve, so which is a sigmoid curve. Here the cervical dilation is taken in y axis and the labor, time of labor in hours is taken in the x axis. So, the cervical dilation can be divided into a latent phase and the active phase. Latent and the active phase. The active phase is further subdivided into 3 phases, which are the acceleration phase, the phase of maximum slope, and the deceleration phase. So, this is the latent phase, then comes the active phase. This is in case of multipara, in which the labor occurs earlier than in primi, and in case of primi, this is the latent phase and the active phase. This is in case of primi, and the first graph was for multi. So, this is the sigmoid shaped Friedman's curve, which represents the pattern of cervical dilation. Next, coming to the second stage of labor, which starts from full dilation of the cervix, that is from 10 centimeter dilation of cervix to the expulsion of the fetus. The second stage lasts for about 1 to 2 hours in primi, and half to 1 hour in multi. And here in second stage, the uterine contractions become more stronger. Also the voluntary muscles, which are the accessory muscles, also begin to contract, thereby helping the fetus, for pushing down the fetus. So, with each contraction the fetus is pushed down through the cervical canal and the vagina starts dilating to receive the fetus. Now, after the perineum is reached, it gets stretched and it begins to bulge. Then the vulva begins to widen. When the presenting part comes behind the symphysis pubis. This is called as crowning. So, with the series of continuous uterine strong contractions, the head initially passes out through the outlet and then followed by the body and then the legs. This is the second stage of labor. Now, the third stage of labor, which is the stage of placental delivery. This is from the delivery of fetus to the delivery of placenta. This is a very important stage, and mismanagement of third stage of labor leads to many complications. So, here there will be characteristic uterine contractions. There is separation of placenta, then expulsion of placenta, control of hemorrhage, and contraction and retraction of the uterus. So, the uterine contractions after the delivery of the fetus, the uterus is found at the level of umbilicus and it will be firm, round and hard, and there will be rhythmic uterine contractions to arrest the bleeding. Coming to the placental detachment, the placental separation can occur by two methods, which are Duncan's method and the Schultz method. So, in this image, the above images show the Duncan's method of expulsion of placenta, in which the placenta folds on itself so that the long axis of the placenta corresponds to the long axis of the uterus. This is the long axis of the placenta, which corresponds to the long axis of the uterus. So, and thereby it comes out, the maternal surface is exposed outside, whereas a little of fetus surface is visible. This is the Duncan's method. Coming to the Schultz method, initially here the placenta separates at the center and leading to a formation of retroplacental hematoma. And by each contraction of the uterus, the placenta separates the same way, and then it presents at the vaginal outlet like an inverted umbrella. So, here the fetal surface comes out, whereas in Duncan's method, the mother's surface of the placenta comes out through the vaginal outlet. And in Duncan's method, the placenta separates at its periphery, whereas in the Schultz method, it separates at the center. This third stage of labor lasts for few minutes, around 15 minutes in average, and in this stage there will be control of hemorrhage by certain natural mechanisms like by the contraction and retraction of the uterus, because of which the middle crisscross layer of muscles act as living ligatures and thereby constrict the vessels. Next is the occlusion of the torn vessels themselves, and then formation of blood clots. All these favor the control of bleeding and prevent postpartum hemorrhage. And once the labor is over, sometimes the patient can occasionally have an episode of rigor, which is purely vasomotor in nature, not because of any infection. This is called as physiological chill or apyrexial shivering. So, this is all about the stages of labor. Thank you.